hope you will find this to be an interesting presentation. What I'm going to do is help you understand a bit about the term. Am I speaking too loud?
No.
No? Okay. And so I'll give you a bit of an overview of thought leadership, a couple of very brief examples, and then the panelists who are in this session will give you some case studies from their own experiences. So I've used different definitions that people have written over the years for thought leadership, but I found this one most recently and I really like it. So I'm going to read it for you at the back if you can't read this. And this is from somebody that works for an agency called Edelman, which is one of the better known public affairs PR agencies who would be advising, I'm sure, CEOs on how to do good thought leadership. So thought leaders are defined as such because they articulate a problem about which others haven't spoken, or because they present a novel approach, and novel means new, approach to solving it. Thought leaders change the way people think and what they do. The best thought leaders are actually trying to address a problem or issue at hand, not just talking about it. So you can't just talk the talk, you have to walk the talk, as we say in English. The way that I like to think about thought leadership is in three different areas. So content, curation, and I did hear someone speaking about that yesterday, and big ideas. So what does that mean exactly? So curation is actually going out and finding what's already out there, but perhaps it's not being brought together in one place. So you can play a role in doing that. And that could be perspectives and views on the subject. It could be bringing leaders and experts together. And in our case studies, we have an excellent example of that. It could be content, so maybe it's research papers, maybe it's opinion papers, but it's bringing all of that content together and also finding all the research and data on a particular subject. So you're like a library, you bring everything together. Unique content is also really important. That's content that no one else has ever created before. And, you know, it can be difficult to do this, it can be costly. So some organizations focus just on the curation, but if you can create your own research and data, that would be great. But you can also create your own collaborations, which is to bring people together. And I would argue that this meeting is actually an example of creating unique content because we have all of these presentations and templates that are coming out of this meeting. We've come together, we've collaborated yesterday in the symposium, and we're going to produce white papers coming out of that. So that's an example of content creation or unique content through collaboration. And providing expertise and experience. So there are things that you all have done that no one else has done, and perhaps there are others that can learn from you. So you become a thought leader in being able to do that. And the third area, and this is one of my favorite areas, but this takes a lot of resources and creativity, is to have a big idea. So it's something that no one has ever done before. And the example I would point to in this room would be the fact that our organization, IADPO, GlobalSkin, actually exists. That was a big idea, and we've made it happen together. And then also our grid project would be another great example because no one has ever done that kind of global research in dermatology before. And so we will be creating something very different. So I think at the end of that, if we do it right, we will be considered thought leaders outside of the patient organization realm. We will likely be thought leaders in hopefully many different stakeholder groups in dermatology. So that means that they will come to us as experts because we will have something they don't have that they need. So there's several steps that I've outlined for having a great idea. So first you need to identify a gap or a need. You need to develop a vision. You need to find other people or organizations, stakeholders to join you. Then you build your plan. You do something no one has ever done. You tell that story, and then you measure your outcomes. And I will hand over the microphone to Katie Coleman.
Hi everyone, I'm Katie Coleman. My case study comes from the National Psoriasis Foundation, where I spent 10 years leading the marketing and communications department for the organization. So the Psoriasis Foundation you see now, the US-based Psoriasis Foundation, which is the largest organization for psoriasis in the world, is very different than the Psoriasis Foundation when I started working there. And I'm going to talk about how we changed and moved and grew from a very small organization to what it is now. So the prevailing thought that when I started, which was in the mid 2000s, early 2000s with National Psoriasis Foundation, is that psoriasis was a cosmetic condition, that it wasn't serious, that there was no point in doing research, that it certainly didn't affect patients, and it wasn't very, we shouldn't take it too seriously. And even patients felt that way. So, but we knew differently, because we would see these patients, we would hear their stories, and they were really struggling with coping with their disease. And at that time, biologics had just come onto the scene. So the biologic drugs that you see now that have been able to control the disease were just starting to ascend. So we were hearing these stories, and it wasn't syncing up with what the rest of the world thought about the disease. So what we started to do, in addition to the stories, is we started to collect data on the patients. We started to collect data from the patients. So we collected patient-reported outcome data about what it was like to have this disease. And we used a set of tools, and we asked them what it was like. Were you embarrassed about the disease? How does it affect your intimate relationships? How does it affect your life, your job? Are you on disability? What kind of insurance do you have? We collected all this type of information. And we began to build a picture of the impact of the disease on the individual. So we had the stories, but then we began to have this data in aggregate. And what we started to do is we started to pump that data out. So to anybody who would listen, we went to the FDA, we went to the CDC, we went to different senators and lawmakers in the US government, we went to the media, we went to anybody who would listen to us to tell the story about these, at that time, about 3 million people who were really struggling with a disease that nobody took seriously. And we also took it to the patients themselves and told the story that we were hearing and gave them the language and helped shape that narrative of the disease, that it's a serious condition. So it sort of snowballed. So as external audiences got interested, more external audiences got interested. So as the media got interested, more of the media came around, and it had a snowball effect. So we began to get cited. We began to use, we began to layer on years of patient-reported outcome data, and as well as stories. And then came a pivotal study, or a study that maybe wasn't pivotal, but we made pivotal. It's sort of the chicken and the egg. And Dr. Joel Gelfand came out with a study where he linked psoriasis to cardiovascular disease. And that was it for us. That allowed us to create a sense of urgency around the disease. So not only did we hammer on this psychosocial issue and what's going on with people, we started to press on the fact that this disease has serious comorbid conditions. This is a serious disease. So we started with the Joel Gelfand study of cardiovascular disease. We have, since then, other studies have come out about comorbidities associated with psoriasis, like depression, metabolic disorder, a couple of others. And we started to sync up, or during this time we synced up with other stakeholders, And we began to tell the story. And so we synced up with other stakeholders. We synced up with professional organizations like the American Academy of Dermatology. We synced up with our industry partners. We synced up with the media. And we talked about, we wanted to be everybody on the same page, talking about psoriasis as a serious autoimmune disease with comorbid conditions. So again, we continue to pound the message. We had a snowball effect, but probably when we figured out that we really had succeeded is when the patients started to say back to us, I have a serious autoimmune disease. This is a serious disease. This isn't a cosmetic disease. So a couple takeaways from this process, I guess, of being a thought leader. You know, it's a little bit. The way we felt at the National Psoriasis Foundation is that we were really a conduit for these stories, that it wasn't our story to tell about the disease, that it really was the patient's story to tell, but that we were a conduit for it. And so some takeaways from that is really data. Root your story in data. Get as much data as you can. When you can break open the door with data, when you can get into the media by saying, 30% of people with psoriasis deal with depression, that's when you can bring in the patient stories. But it's important to have those large data sets too. Be available for everything. So every time the media called, anybody called, we answered. We had a patient, we had somebody to talk to them, we had an expert, and we were available. Didn't matter the outlet that we responded right away, and we told the story. Work in collaboration with your external partners, industry, professional organizations, but also speak truth to power. I remember really, taking it to the mat with the American Academy of Dermatology, who said, this disease, no, we're not going to say that. We're not going to say it's autoimmune because we think it's inflammatory. And we're saying, well, we say it's autoimmune, or doctors say it's autoimmune. And so really speaking truth to power. And now the way that the disease is spoken about in sort of the larger world is the way that we started talking about it. So speak truth to power. And then repeat all these steps over and over again.
So I am Antoine Lixon from France. I'm representing the French patient organization for albinism. This association was created in 1995, and last year we had about 370 members. You must probably know that albinism is a pathology associated with a lack of pigmentation in the skin, in the hair, and in the eyes. But most probably you don't know that albinism is a genetic condition, a rare condition, that is also responsible for strong visual impairment, and it can also affect other organs in very rare cases, such as the blood, the lungs, and the intestine as well. So I would like to share with you some of our experience through 3 case studies that I believe illustrate the idea of thought leadership. In 1995, when the association was created, there was not a single research program conducted on albinism in France. So I believe that the founders of our association, when they created it, they had in mind to promote as much as possible research programs. Because if there's no research ongoing, there is no hope for the patient, no hope for future treatments. So it all started in 1998 when we decided to fund a 3-year PhD thesis. Unfortunately, this did not really bring the results that we were expecting. We were quite disappointed, so we took a little time to think and to build ourselves a new strategy. And eventually, in 2007, we launched our first annual call for research programs. And this shown to be the right approach. because since then we've been holding every single year an annual call for research programs. And as a result, we have built a very strong collaboration with 2 labs in France conducting research programs on albinism in 2 different medical fields. One of these labs, has actually become a world reference for the genetics of albinism. Unfortunately, there's no treatment that has been discovered yet, but at least the French patients can benefit from the best genetic diagnosis that you can expect in the world today. And I have to say that I'm proud also to mention that Jeune Espoir is mentioned in scientific papers on a regular basis, and our association is actually considered as a reliable organization in the medical world, at least in France. So this was for the first case study that I wanted to present. Let me now share with you another example which starts with the following gap. As we were gaining experience, we've realized that for many reasons it was impossible to develop ambitious programs, research programs on albinism at the level of our country. And at the meantime, we got the strong impression that there was very little coordination, if not no coordination, among the few medical professionals and researchers at the international level that were working on albinism. So what we did is that we decided to organize a European conference, an international, scientific conference, to gather all these experts together. This is what we call the European Days of Albinism. This was a real success, and we're actually now getting ready for the 4th edition of this conference. So thanks to this conference series, we have built an international scientific community around albinism with a strong link with the patient associations. We have created a group-wide emulation, and this event significantly helped us promote research programs and foster scientific collaboration. On the top of that, the creation of an international scientific committee for our European network of associations was also a very nice outcome of the European Days of Albinism. And let's now jump to the 3rd case study before I reach my conclusion. As I mentioned previously, albinism is not just about the skin and the physical appearance. It is a multidisciplinary medical condition involving dermatology, of course, but also ophthalmology, genetics, and other medical specialties. But unfortunately, the patients are never offered a global approach by the medical professionals. Each specialist, each medical specialist takes care of his own field without any or with very little coordination with his colleagues. And very often, this leads to an insufficient health care and, in general, to a slow improvement of the medical knowledge on our pathology. That's why we decided that an albinism multidisciplinary clinic had to be created. We discussed this project for the first time in 2007 with a group of medical experts in France. And we got a positive reaction from one team from the Bordeaux University Hospital, but a negative opinion. We received a negative opinion from the main children's hospital in Paris. So we just decided to develop this program with the Bordeaux team. This took time, but eventually an Albinism Day hospital opened at the beginning of 2014. This was exactly what we were looking for. Straight away, it became clear that this specific clinic for people with albinism was indeed very useful. It was useful for the reasons I mentioned previously. but also because it is a great environment to develop research programs. We gather data. And as a matter of fact, those medical professionals from the Paris Children's Hospital that were not interested by our project in 2007, they eventually decided to create their own Albinism Hospital in 2017. So now I've reached my conclusion. What did we learn from this experience? I don't know how much this is something new. I don't know how much our experience is that unique. But let me just tell you what I had in mind when I went through these case studies trying to find a few conclusions. The medical professionals or our partners, of course, I respect them very much. We need them. But I don't think we should expect from them to tell us what our role of patient organization should be. Some of them know, I think, have a good idea. Some of them maybe don't care. But I also know that some of them are just wrong in what they think about patient organizations. That's my point of view. A second point, I think that we should never think that a patient leader with no specific medical degree is not allowed to get actively involved in the medical world. You have the right to be involved in the medical world. You just need to learn the rules that apply in this environment to correctly get involved. And the last point, I think we should keep in mind that medical professionals receive a long and consistent training before they actually start working. Whereas we, patient leaders, we have to learn everything by ourselves. It might take time, but it's completely feasible, I think. It just requires time and motivation.
So I founded this association in 2001. Shweta in Sanskrit means white. So we didn't dare to call it as a vitiligo organization because there was very little acceptance from the society. So we called it as Shweta Association. I myself have vitiligo since the age of 10 years, which was under control for 35 years. And then I took some treatment to go away whatever little patches I had, and I got totally depigmented in 6 months. Then I said that being a doctor, I am a surgeon, general surgeon by profession. So this can happen to me. I don't know anything about the disease and treatment and what is this going on. And then I had an occasion to visit USA. Many of my relatives are in USA, but when the disease was obvious, I didn't dare to go anywhere. And when I went to USA, it was such a relief. Everybody was looking like me. So that was the turning point. And immediately within 3 months after coming to India, I started this organization. You might be knowing, but India is a tropical country, and percentage of vitiligo all over the world is 0.3 to 1%, but in India it is up to 2.5%. But because of social stigma, nobody was coming forward and doing some activity or bringing these people together. So being a doctor, I thought as a patient and as a doctor, I had a little more depth into the subject. Then I really studied vitiligo for 13 years. Any research, any paper, any book, I was just going, reading. And then I founded this association with 10 to 12 of my patients who had vitiligo. And now we are 3,000 member strength association.
2,000?
3,000. Yeah. So the biggest problem was, as I told you, a social stigma. Vitiligo is known in ancient India since last 5,000 years. It is known as Shweta Kushta, means white skin. but it is confused with Kushta Rog, that is leprosy. And you know that leprosy was having highest social stigma until now. So the great stigma was attached to vitiligo. Other cause was because it is obvious, visible, so people are scared. And there is one again thought that it comes hereditary in the next generations. So everybody used to say, oh no, we don't want it, it will come in our children or next generations. So these are the three main causes for the social stigma in India. So how to go about it? I was thinking for some 8 to 10 years how to go about this. And we started awareness campaigns to avoid the stigma. Basically, two types of awareness. Patient should know what is the disease, and then society should know what is the disease. So for this, we produced a lot of pamphlets. We literally bombarded media. They also gave us a lot of hand because nobody was writing about it, nobody was speaking about it. You were seeing so many patients on the road, so many flyers, booklets, and even dermatologists wrote one monogram for us, which we handed over to many GPs because they also needed some awareness about vitiligo. And in the year 2005, we produced this feature film, Nita. I don't know about others, but Indians are very crazy after movie.
Yeah.
If doctor says something, they will say, oh, he doesn't know what I am going through. Oh, but that Amir Khan or someone tells, oh, they are really, oh yes, this is true. So, so to change the mindset of the people and to reach to thousands of people, we produced this movie. And that is also a big story. I was crazy that yes, I want to do it. And our budget, whatever it was, we had only 20% of the money with us. So we thought bank will give us loans, there are many big industrialists who are having vitiligo, someone will donate us and we will do it. Nothing happened. So I sold one of my property and then I borrowed money on zero interest loans from my friends and family members, and that is how we could complete it. But then it turned out to be best movie of the year. So we got award from government and we could repay all the loan. And this 0% loan concept later on, many NGOs picked up from us for their some programs or something. So as I said, counseling to patient was very important. We gave them scientific medical information that this is just an autoimmune disorder, this is lack of pigment, it is not sin or something, because there are misconceptions that if you have done some sin and then you get it then this is not a life-threatening disease, and you make friend with the disease and live with it. If you start fighting with it, then condition becomes difficult mentally. So that was for the patients. And for families, it was very important because emotional support comes from family, and then financial support, and access to best medical care that family has to provide. Especially in young children, we had a lot of problems. When their parents knew what is the stigma, children don't know, but parents try to segregate them, overprotect sometimes. And especially there was bullying in schools or colleges. So we had to counsel parents first. And they should clearly tell the baby that what is the problem. Because children are inquisitive, they ask, oh, what is this on my body and all. But usually parents used to hide it. Oh no, it's nothing, it will go away, we'll do that, we'll do that. And in schools, you have to make the teachers aware to avoid bullying. Sorry. So we have very strong media presence. Like I told, we have done the movie, probably it is the first movie in India at least on the theme of vitiligo. Then we have our website and Facebook and WhatsApp and other things. I will just run. We are organizing many events for social awareness, like running event. There are 3 advantages. More people come for the event like this. Then we get participants from schools, colleges and other things, and volunteers from this group. We have matrimonial assistance, and we have conducted 31 camps up till now, and about 1,000 girls and boys have been married through us. We provide marital counseling also. And we are doing musical fundraising programs for last 2 years. Rotary Club of Pune Metro for the first time gave us this phototherapy machine, which we are giving free to our members and also to the psoriasis patients. So there are 90 members of vitiligo and 20 of psoriasis which are taking treatment from us. Skincare, camouflage. No, people even didn't know about sunscreens. We have to make them aware. Our major accomplishments are there. Our presence in 7 cities. We would like to have more branches. Indian Association of Dermatologists, Venereologists is with us. Most of them are my friends, even the people who treated me. So we are very good friends. I was president of Indian Medical Association, which is a 4,000 doctors strong branch. So we are reaching to them also. I am president of SETU, that is Self-Empowerment Through Unity. It is an association of 15 associations related to health, like dementia and epilepsy and so many others. So that is how is our networking, and we got 15 different awards for this. One thing I would like to share with you, we kept on growing, how we evolved, because every 1 or 2 years we gave something new to the patients.
Yeah.
Like we started Marriage Bureau in the year 2003, produced the film in 2005. Like this, started the treatment, so young boys and girls started coming to us. So like that we evolved. And the only concern I want to mention that most of our volunteers are people not having vitiligo. The vitiligo people who come to us, once they are satisfied by, say, counseling or marriage assistance or treatment and camouflage, well, they go into their own shell. They don't want to work anymore for this. So that is my concern. Thank you.
Thank you.
Thank you so much.